brings us to your weekly capsule of health information. We call it Your Healthy Dose. Ever been in pain? We're going to talk about pain and much more. Joining us is Dr. Mark Vadney, and Doctor, good to see you this morning.
Good morning. Thank you for having me here.
So we're talking about pain. People, I know at some point in their life they'll maybe have some joint pain or something else, and then maybe as they face the inevitable, that surgery, maybe replacement joint surgery, or maybe something to fix the problem, they're put out to kind of kill the pain, get the procedure done, and then eventually that wears off. So we're talking anesthesia. There's a difference between the application of anesthesia.
There are two types of anesthesia that we often provide. One is general anesthesia, and one is regional anesthesia. General anesthesia is what most people think about when they think about having surgery. Mm-hmm. They go to sleep. They go into the operating room, we give them some medication, and that's the last thing they remember. The advantages are, for those who are a little bit more squeamish, they will know nothing about what happens in the operating room. They will just enter and then wake up after the procedure. The disadvantages that some people are not necessarily aware of is going to sleep isn't as strong of pain control. It puts you to sleep, and then we give you medications that people are familiar with, like morphine, to help control the pain, but we don't actively attack the pain. We just treat the symptom. The other version we have is regional anesthesia. Sometimes people think of it as a spinal. You'll hear people talk about having a spinal. The advantages of that is there's less nausea afterwards, because we're not giving the gas that people breathe, which makes them nauseous. It also makes the patient, if they're having a knee surgery, numb from the waist down while the procedure's going on. So when you have the spinal before the surgery starts, the nerves that are being worked around aren't being aggravated. They're not getting angry. I don't know, when you were a kid, if you ever got an Indian rug burn, or someone would punch your arm repeatedly, and then all they'd come up and touch that arm, and it hurt incredibly.
Like crazy. Yeah.
That touch shouldn't hurt, but because that nerve's been aggravated repeatedly, that simple touch now hurts. Well, by giving someone a spinal, they are numb from the waist down before the surgery starts, so that nerve's not getting angry. They're still going to have pain post-operatively, which we will still treat, but it's not as overwhelming pain. So ideally, when we do a knee surgery, a lot of times we have a practice where we will give them a spinal so that they're numb, so that they don't get that aggravated pain. We'll give them what we call a block, which is we'll give them often when you go to the dentist, they'll numb up a tooth. Well, we'll do the same type of thing. We'll numb up the nerve with a long-acting pain medicine, so that after your spinal wears off, you still have this numbing medicine which will reduce the pain. And then we'll also treat them with narcotics as well as Tylenol and other pain medicines. Pain comes on a whole lot of different flavors. And when you treat pain with just one answer, you don't manage it all. So ideally, what we'd like to do is treat all the different little areas, so that this surgery, which with rehab and the parts that are going to affect your life in a whole bunch of different ways, we'd like to make pain and nausea one of the smallest parts you have to worry about. We want this to be a pleasant adventure as possible. And sometimes, this surgery overwhelms our life, and we'd like to make that as a little less terrifying.
Doctor, you talk about the adventure. It is a big deal for people when they are facing an operation, a surgery. Is it something where they can choose and talk about in advance whether they want to do a general or a regional anesthetic, and how they would like it to look?
Well, a lot of time before you go into surgery, ideally you'll come in and have a meeting with the hospital staff, and they'll discuss what's planned, what will happen as far as physical therapy, anesthesia, and you'll get the opportunity to find out the differences between the different types and what you're comfortable with. and we'll explain what works and what are the advantages and disadvantages, and that will give everybody the opportunity to go in with knowledge. If you go in with knowledge about what to expect, it's less likely to be as scary. And if you don't like the idea of regional anesthesia because you just want to be asleep, that's fine. We'll work with you. Maybe you don't like the spinal, but we'll give you a block and we'll have you go to sleep so that you get a little bit of the pain control and you get a little bit of the I have no idea what's going on whatsoever. So it's a combination. It's a team effort. It's a team effort between the patient, the physicians, and then once you get there for the surgery, it then becomes a team effort for everybody. It's, now with hospitals changing, everything is becoming a team effort. It's the nursing staff. It's the cafeteria with diet. Everything becomes part of the team effort. And the patient has to be part of that team too. We have to know what they expect, what they want, where they want to be, and we want to make it all come together. And the most important part of that team is the patient.
Okay, so you have the surgery, you go through the process, you end up after the surgery, post-operative, you're not feeling so great. You've got some nausea. What do you do at that time?
Well, the best thing to do is attack the nausea preoperatively. For me personally, post-op nausea is my enemy because that is something I can deal with and work with beforehand if I pay attention. Again, just like pain, there are a whole lot of different ways to attack nausea. And personally, you're coming in here for surgery, you're going to have some discomfort, you're going to be in a strange environment. There's a whole lot of things. I don't want you to be nauseous. That's just one and often that's something that patients have a problem with. So I'll give some patients some medicine before they go to surgery, simple things like a scopolamine patch, which people use for seasickness.
Oh, okay.
And which also helps with nausea. And I will give some other medications preoperatively for nausea, and then we'll give you some medicines intraoperatively, and then postoperatively, if you have any, we can still manage it. I think one of the nicest things that nobody ever hears about here at Hannibal Regional, where I work, is that very few people, if any, very few people get any nausea at all, and rarely do my patients actually get sick, because for me it's a point of pride. You're coming into my home. I want you to be a guest. I want you to be comfortable, and I can do something about that if I take the time and go ahead and get you ready for surgery.
You see what you've done now is you put your name out there on the line. Everybody's going to want you to put them out because they know they're not going to get sick.
Well, I'll tell you, I have a lot of wonderful partners at the hospital, and we all as a group are actively trying to make sure that people are comfortable. And I can't say enough about the entire organization. They've all come around, and we're all trying. With Obamacare and all this other type of stuff, there's been a rebirth in the country about making the patients the primary. You would think, big hospitals around the country, it's a machine. And that's the nice thing about Hannibal Regional. We're a smaller hospital. It's almost like a boutique. The patients are so important to us. And, whether it's checking in on the patients, everyone from the housekeepers to to maintenance, to the nurses, to the physicians, that patient's important to them. That patient, is how can they be an important part of this patient's adventure through the hospital. And, my part is to make sure that, I want to make sure they're safe in the operating room. I want to make sure that they are comfortable pain-wise. And I want to try to avoid the uncomfortableness of being nauseous afterwards. That's what's really the most important is the patient.
Yeah, and you work to educate them and kind of travel them through that adventure, as you say. You've got a free seminar coming up to get that process started, right?
Correct. Correct. At Hannibal Regional Hospital has a bone and joint clinic. And for example, this Thursday, November 14th at 11 a.m. at the Quincy Public Library, they will be hosting a clinic to give you some answers to questions that you have. The most important part for anything, whether you're getting your car fixed or you're having surgery, is to find out, to get educated, to learn. And the best opportunity is when people come out to your community and say, ask me your questions, because that's what we thrive on, teaching. Back a long time ago, physicians were teachers, and nursing were teachers. They teach people. They teach people how to take care of themselves. And that's where we need to get back to is, teach people how to be to take care of themselves and get the surgery they need, do the proper post-operative care to make sure they get all their, make the most of their lives. People are living longer, so let's enjoy all that extra time we're getting.
Sure.
It sounds like the big key to all of it is communication, and you're giving the folks the opportunity to do that. That's a really good thing.
That's it. Next Thursday at 11 o'clock at Quincy Public Library. And again, if you got questions, there will be representatives from the Hannibal Medical Bone and Joint Department, and they'll be there free of charge, by the way. All right, Doctor, it's been a pleasure. Thank you very much for joining us.
Thank you very much for having me. I've enjoyed it.
Dr. Mark Vadney joining us here on Your Healthy Dose. And Your Healthy Dose, your weekly capsule of health information brought to you by our friends, Hannibal Regional Hospital and Hannibal Regional Medical Group. More information online at hannibalhealth.org.